Hello, my name is Leslie Cordial, and I will be discussing an integrative literature review within the adult acute care population on the care of central lines. The healthcare problem selected for this review is healthcare-associated infections, most specifically central line-associated bloodstream infection, or CLABSI. Healthcare-associated infections related to CLABSI reduction in the acute care setting is the topic for this review. Healthcare-associated infections are among the leading causes of preventable deaths in the United States and are associated with a substantial increase in healthcare costs each year. Despite success in the availability of evidence-based standards, wide variations in CLABSI rates across hospitals remain. This suggests disparities in the adoption, compliance, and sustainment of recommended protocols. In 2011, the Center for Disease Control and Prevention stated that an estimated 722,000 hospital-acquired infections were recorded in the U.S. acute care hospitals and roughly 75,000 hospitalized patients died during their stay. 1 in 25 inpatients will develop an infection related to hospital care. Most literature reviewed is aimed at CLABSI reduction in the ICU setting. However, 70% of hospitalized patients with central lines are outside of the ICU. So my question is, how can CLABSI reduction be applied to the acute care setting? There were 4 studies that were chosen for this review. The first one, Noto et al., used a cluster randomized control trial designed to determine the daily application of chlorhexidine to decrease the incidence of hospital-associated infections. The second study, by Evans, Hain, Kier, Dork, and Schroff, used a randomized controlled trial designed to explore the effects of prescribed showers versus non-showering on catheter-related bloodstream infection rates with tunneled hemodialysis catheters. The third study, by Kassikan, Mermel, Parental, and Mason, used a quasi-experimental design study with the purpose to study the effectiveness of chlorhexidine bathing outside of the ICU setting on hospital-associated infections. Timsit et al. Conducted a randomized controlled trial using a 2x2 factorial design to compare chlorhexidine, gluconate, impregnated sponges versus standard dressings on central lines, and to compare a strategy of changing unsoiled adherent dressings every 7 days versus every 3 days. The study findings were Noto et al. Reported 55 total hospital-associated infections during the chlorhexidine bathing compared to 60 hospital-associated infections in this open water group. Evans et al. Reported 2 episodes of positive blood cultures and 3 tunneled catheter infections in the shower group versus 0 in the non-showering group. Kakiskan et al. Stated that the overall compliance with chlorhexidine bathing was 77%. They reported 10 cases of hospital-associated infections with the intervention group compared to 20 cases with the control group. Timsit et al. Reported that the use of chlorhexidine impregnated sponge dressings decreased the major catheter-related infections from 1.60 to 1.40 per 1,000 catheter days. They also stated that chlorhexidine can decrease the major catheter-related infections by 60%. These study findings can be applied by the adoption, compliance, and sustainment of recommended protocols. Health promotion and patient-centeredness was the main focus of these studies. The studies all took place in the adult population, and chlorhexidine application was studied to decrease the incidence of hospital-associated infections and CLABSI. The empowerment of the patients with long-term catheters is essential in the maintenance of central lines. The value of these studies for nursing practice is to increase the focus of the prevention of central line infections. Having an independent patient with a central line can be tricky, whether it is a peripherally inserted central line, triple lumen deep line, or Udall for hemodialysis. It takes teamwork for all involved. It is the nurse's responsibility to make sure proper measures are being taken to ensure that the patient will remain free from infection. But the independent patient must be educated on proper hygiene and cleanliness to also keep the line free from infection. So the proposed intervention would be for the nurse and the patient to have a contract during their stay with the maintenance of central lines. An example would be for the dressing of the central line to be changed on the same day every week, but the daily application of chlorhexidine could be up to the patient, and the nurse must verify that the task had been completed. So the environments of where that this intervention could take place would be all adult acute care areas and outpatient hemodialysis clinics. Thank you.